Autoimmune diseases are strange. One day, you feel fine. The next, you're bloated, foggy, flaring up, and wondering what just happened. This isn't random. There's a root cause, and it's inflammation. And if you don't track it, you'll never truly tame it. Autoimmune diseases aren't like other chronic conditions. They don't follow a steady, predictable path. They come in flare-ups, waves of inflammation where your immune system attacks your own body. And the number one thing driving those waves? That's right, inflammation. You have flare-up days where inflammation markers spike, and symptom-free days where they calm down. And the difference between the two comes down to how well you're managing that internal fire. But here's the problem. Most doctors don't even run inflammation markers when monitoring autoimmune patients. But they should, because tracking inflammation is how you actually measure progress. Without it, it's like driving with your dashboard blacked out. You can't see the warning lights until your engine blows. So what are the markers that matter on your blood test? Let's break it down. The blood tests that tell you the real story. First up, there's ferritin. It's not just an iron marker. It's also an inflammatory protein. If your ferritin is high, it often means that your body is under stress or inflamed. It's not just iron overload. It tracks your inflammation. The next one I like to run is CRP, which stands for C-reactive protein. It's made by the liver, and it shoots up during acute inflammation. A normal reading on a blood test is under 10 milligrams. If it's elevated, something is burning behind the scenes. Another one, ESR, which stands for erythrocyte sedimentation rate. This one's old school, but very helpful, as it tracks how fast red blood cells settle in a tube. The faster they fall, the more inflammation you have. A normal rate would be between 0 to 22 millimeters for men and 0 to 29 millimeters for women. It's not specific, but if it's high, something's going on. Another one you need to know is PV, plasma viscosity. This one tells you if your blood is thicker and stickier, often due to chronic inflammation or immune overdrive. A normal reading is between 1.3 to 1.7, and it's great for tracking autoimmune activity over time. Next up, we have IL-6, interleukin-6. This one's powerful. IL-6 is like an inflammation amplifier, and it's elevated in nearly every autoimmune flare-up. Normal is under 7. If you're flaring, IL-6 is likely spiking. This next one, PCT, or procalcitonin. It's usually used to rule out bacterial infections, but it's also useful in tracking a systemic inflammatory overload. A normal reading is under 0.1. And finally, we have CD4-CD8 ratio blood test. This is a real bonus for deeper immune tracking. These immune cell ratios tell you if your immune system is imbalanced, which is often skewed in autoimmune cases. When you monitor this test regularly, which I like to run every 2 to 3 months, especially during a flare-up phase, you get a real-time map of how your body's doing. It's not about chasing symptoms. It's about tracking the fire before it burns the house down. These markers help you answer questions like, is this treatment actually calming my immune system? Are my flares getting better or worse? Is my present supplement protocol working or hindering me? And am I headed towards remission or another flare-up? One of my patients was told that her Hashimoto's was under control, but she still had brain fog, weight gain, joint pain, and just couldn't sleep. We ran her CRP, ESR, ferritin, and IL-6. All were elevated. Her inflammation was under control. It was just ignored. Once we treated the inflammation, her energy came back. Her brain cleared. Her body finally stopped fighting itself. You see, autoimmune diseases don't just calm down on their own, which is why they must be tracked. And when you do, they can be tamed. The symptoms can be reversed. You don't have to stay stuck in flare-up mode. You don't have to keep guessing. And no, you're not crazy. dramatic, or imagining it. You're merely inflamed. If your doctor says that your labs look normal, but your body is exhausted, swollen, foggy, or in pain, that's your signal to stop accepting surface-level answers. Because when it comes to autoimmunity, normal labs often miss the real story. The truth is, your body isn't attacking you. It's trying to protect you, but it's confused. And inflammation is the language it's using to cry for help. So what do you do now? Let's bring this home with a real roadmap. Step 1, track your inflammation. Ask your doctor for these blood tests every few months, especially after flare-ups or medication changes. CRP, C-reactive protein. ESR, also known as erythrocyte sedimentation rate. Ferritin, IL-6, plasma viscosity or PV, and CD4-CD8 ratio. You can also test for procalcitonin or PCT if infection is suspected. These markers give you a real-time look into whether your body is fighting with you or against itself. Step 2, identify your triggers. Look back at your last flare-up. What did you eat? How are you sleeping? What stress was happening at the time? Did you change any supplements or medications? You see, autoimmunity is like a detective case. You need patterns, clues, and once you spot the triggers, you can finally start avoiding them. Step 3, lower the inflammatory load. This isn't just about medication. It's about creating a low inflammation lifestyle. Start with an anti-inflammatory diet that's low in sugar, processed foods, nightshades, and gluten. Next, reduce your daily stress by doing proper breathing exercises, walking, journaling, cold exposure, meditation, or even prayer. Basically, whatever works. Make sure to get a restful, consistent night's sleep. And also, make sure to take key supplements like turmeric, omega-3s, magnesium, vitamin D, and gut support. Step 4, find a practitioner who'll listen. You need someone who will look at your full health puzzle, not just run a TSH test and call it a day. Look for functional medicine practitioners, integrative doctors, or even patient-led communities that focus on root cause healing. And finally, step 5, don't give up. You're not broken. Autoimmunity is not a life sentence. It's a call to action. Your body is asking for help. Your job is just to listen and lead it back to balance. So if you've been told there's nothing more we can do, or even worse, your labs look fine, but deep down you know something's still wrong, then it's time to ask better questions. Time to demand a better map. Time to give your body the support it's been quietly begging for. Because now you have direction, you have tools, and most importantly, you have hope. Hit subscribe and share this with someone who needs this clarity today. You're not broken, you're not weak, you're just inflamed. And now you know the rest of the story. Thanks for watching, and I hope this video gave you something valuable to take away. Your next step is just one click away. Check out our next video right here. And if you want to join this community and see more content like this, hit subscribe and give it a like. I truly appreciate the support.